Hi, in this video we will learn about modifiers which we use along with the CPT codes, and these are numerical modifiers which are present in CPT book page number 967. So in this appendix A you can find all numerical modifiers, 2-number modifiers. All 2-number modifiers will be given here and their explanation will be given here. And in the new books nowadays, on the cover page itself they give their modifiers and also their explanation there. A short explanation will be given on the cover page of CPT book. So you don't have to, if you want to check modifiers during the exam, you don't have to come and check this appendix A. You can check it on the cover page of CPT book. So now we will see about the modifiers. The first modifier is 22. 22. It is used for increased procedural service. Increased procedural service. That means doctor is taking some extra time, or there is some difficulty in the procedure, or the patient's condition is having some problem. So there is some increased effort that has to be put by the doctor. In such a case, you will be using this modifier 22. So whenever an unusual procedure is done for an increased time, you can use modifier 22. And this modifier 22 cannot be used with E&M service codes. We use this 22 with skin chapter, and also with one urinary system procedure also we use 22. So mostly we will use with skin and urinary system. Other than that, I haven't seen we use this 22. So whenever the procedure is complicated, it takes extra time, we use modifier 22. Next is 23. That is used for unusual anesthesia. Normally for big surgeries only we give general anesthesia. But sometimes we give general anesthesia for a simple procedure which does not need anesthesia at all. For example, I have a patient of age 1 year. It is a baby, but I have to take a MRI scan for the baby. But the baby is not cooperative. I don't know what to do. So I am giving anesthesia, making the baby unconscious, and I am going to take the MRI scan. But normally for an MRI scan, we don't need any anesthesia. But in this case, I have given anesthesia because of the uncooperativeness of the baby. So this is an unusual situation where I have given anesthesia. In such a case, along with the anesthesia code, I will add modifier 23. Modifier 23. That will say that I have given anesthesia in an unusual circumstance. That is about 23. Next is 24. It is unrelated E&M service by the same physician during a postoperative period. For example, patient has undergone a surgery from me, and within the postoperative period, for example, if it is a minor surgery, within 10 days, patient has come to the hospital with a new problem, and I am examining the patient and giving some treatment also. Then I can use this modifier 24 with the E&M code that will say that patient is actually in a postoperative period, but this problem is a new problem, and I am the same doctor who did the surgery and also the evaluation. So I can use modifier 24 for that purpose. And you can note down, for minor surgeries the postoperative period is 10 days. For major surgeries it is 3 months or 90 days. So that is called as postoperative period, after the surgery. Next is modifier 25. I think I don't have to explain about this. We have seen this many times. So what is the use of this modifier 25? Yes. Whenever a significant E&M service is provided on a same day of other procedure or other service. For example, patient has come for this OMT or CMT. That time I am doing an E&M also. Then I have to report an E&M code with modifier 25. With modifier 25. This will be always reported with E&M codes. Next is 26. This also we learnt recently in radiology chapter. What is the use of modifier 26? professional component. Yeah, whenever a doctor or a physician who is providing interpretation and report, it can be a pathological service, it can be a lab procedure, or it can be an X-ray or scan procedure. In such a case, you will be using modifier 26 for professional component for the doctor's work. Next is 32. 32 will be used for mandated services. Example, you can write consultation services in E&M chapter. Consultation services in E&M chapter. We see about this modifier 32. What is this mandated service? Sometimes some treatments or some examination will be mandated by the third party insurance company or by the government or by the legislative department or regulatory department. They force us to do something. For example, there is a patient, he is a criminal, and they want to evaluate the patient's mental status. So they need a psychiatrist evaluation. Patient has come for some normal checkup, but that time the legislative department is telling that they need some psychological evaluation also. In such a case, you have to give modifier 32 with the service whatever that is provided. So for mandated services, you will use modifier 32. Next is modifier 33, which we don't use here because it is used only in USA. We can skip that. Take modifier 47. This modifier 47 will be used whenever anesthesia is given by a surgeon himself. Usually, whenever a surgery is done, there will be a doctor who is doing the surgery, and there will be an anesthesiologist who is giving anesthesia. There will be two doctors, one anesthesiologist and one surgeon. But sometimes there won't be any anesthesiologist. There won't be any anesthesiologist. Only the surgeon will give anesthesia. Only the surgeon will give anesthesia. In such a case, don't report any anesthesia code. Don't report any anesthesia code. Just report surgery code with modifier 47. So whenever surgeon is giving anesthesia, we don't have to report an anesthesia code because there is no role of anesthesia doctor there. So we don't have to report anesthesia code. Report only the surgery code, whatever the surgery is. For example, doctor did appendicectomy surgery, removed the appendix. I will report a code for appendicectomy along with modifier 47. That will convey that doctor has given anesthesia also. He didn't get any anesthesiologist support. There was no anesthesiologist. Only the surgeon himself gave anesthesia. That is modifier 47. Next is modifier 50. This also I don't have to tell. What is this modifier 50? Bilateral procedures. And there is an important guideline. Never use modifier 50 with add-on codes. So that is the thing you have to remember. Bilateral procedures means it is done on both right and left sides of the body. Both right and left sides of the body. Next is modifier 51. This is for multiple procedures. Whenever 2 or 3 procedures that are done at the same time, we use this modifier 51. There is a difference between modifier 51 and 59. 59, they say it is a distinct procedure, 2 different procedures. Here it is multiple procedures. But never use this modifier 51 with E&M codes, physiotherapy and rehabilitation services, and with vaccines and immunoglobulins. You cannot report this modifier 51. And also, this modifier 51 cannot be reported with add-on codes. Cannot be reported with add-on codes. I will tell you some examples for multiple procedures. In skin, for example, I am going to do a biopsy. Normally, that biopsy doesn't require suturing. But I am doing this biopsy, and after doing the biopsy, I am noting that that area has to be sutured. I did a suturing also. So in such a case, I will be reporting a biopsy code with suturing, and for the suturing, I can use modifier 51 and say that I have done multiple procedures at the same site. So that is about modifier 51. Modifier 51. So when two or more procedures are done at the same site or related to each other, we can use modifier 51. Next is modifier 52. This also I don't have to explain. We have seen this many times in the medicine chapter. What is modifier 52? Reduced service. Whenever a surgical procedure or procedure is not completely done according to the code description, we are not doing it, we are reducing it, then we will use modifier 52. So examples, medicine chapter codes. One more you can write, colonoscopy. Colonoscopy. Next is 53. 53 will be used for discontinued procedure. That means they started a procedure but they stopped it. But again they are going to repeat it after some time. Maybe next day or after 1 week they are repeating the procedure. So the procedure was discontinued or terminated. It can be a surgical procedure or a diagnostic procedure. Maybe due to the health condition of the patient, they were not able to complete it. Then you can use modifier 53. 53. And for this also, near that you can write colonoscopy is an example for this one. Colonoscopy. Next is 54, 55 and 56 is related to surgery. I told you before, whenever a surgery is done, there will be some things covered under the surgery, like preoperative evaluation of the patient and the day of surgery, and after the surgery one postoperative evaluation is also covered under the surgical care. But sometimes the doctor who is doing the surgery would not have seen the patient before the surgery and after the surgery. He is just providing the surgical care, no preoperative care, no postoperative care. Then you can use modifier 54 with the surgery code to say that doctor has given only the surgical care. So what is 55? Postoperative management only. Doctor did not do the surgery, doctor did not give preoperative management, but he is taking care of the patient after the surgery. Then you will be using modifier 55 for the doctor's work. And 56, it's for preoperative management. Preoperative management. That means before the surgery. Only care that is provided by the doctor is before surgery, not the surgery and after the surgery. So surgery was done by someone, postoperative care was done by someone, only the preoperative care is done, then you can use modifier 56. Next is modifier 57. It's decision for surgery. Patient has come for some consultation and on the same day doctor is deciding to go for a surgery. So there is an evaluation management done and on the same day doctor is deciding for a surgery, then you can use modifier 57 with appropriate E&M code. That is decision for surgery. Next is modifier 58. Staged or related procedure during postoperative period by the same physician. For example, a patient has got some problem and this is little complicated surgery. So I'm not going to do it in a single day. What I will do is I can split the surgery into 2 procedures and do it on 2 different days. And this is usually done in the postoperative period only. If it is a minor surgery, within 10 days I will do both the surgeries. But it is actually one surgery. But I am doing it as staged procedures. Or there is some related procedure to the previous procedure, I am doing it within the postoperative period. Then I can use modifier 58. Modifier 58 will be used for staged or related services or procedure which is done by the same physician during postoperative period. Next is modifier 59. This modifier also we come across many times for distinct procedural service. Distinct procedural service. That means two different procedures are done at the same time. Actually, we use this 59 whenever a same procedure is done at two different locations. For example, I am going to do two biopsies from the skin. Two biopsies from the skin. One is taken from the hand, one is taken from the leg. In this case, I am doing two biopsies and two are not related to each other. One is done in hand, one is done in the leg. So I will be reporting two biopsy codes, and for the second procedure I can use modifier 59 and convey that I did the distinct procedure from the first one. I did biopsy only, but it is not done in relation to the first procedure. It is done at a different location and distinct location. Then I will be using modifier 59. Modifier 59. And modifier 59 cannot be reported with ENM codes. Note down that it cannot be reported with ENM codes. Next is modifier 62. When two surgeons are performing a single surgery, that means they are sharing the work, then we will use modifier 62. And how we will report the codes? We have to report the surgery code 2 times with modifier 62. For example, I am just randomly telling a number. For example, the procedure code is 62080. I will report it as 62080-62, 62080-62. Like this I have to report. If it is modifier 62, I have to report the code 2 times with modifier 62 and convey that two surgeons are performing the surgery. For example, this is related to nervous system. With many procedures in nervous system, we use this modifier 62. Next is 63, which we don't use much actually. It is used when the baby is less than 4 kg. We are doing some surgery in a baby and the baby's weight is less than 4 kg. We can use this modifier, but we never come across this, so we don't have to worry about this. Next is 66. This will be used for surgical team. This also we don't come across, but when a group of doctors, for example, just imagine that patient has met with an accident and he has got so many damages in the body. For example, brain is damaged, many bones are fractured, intestine has got damaged, heart has got some damage. Like that, there are so many things. In such a case, there will be different doctors who treat all the problems will be present in the theatre. So that is surgical team. A group of doctors or a team of doctors is providing surgical care. Then I will be using modifier 66 with the procedure codes. Next is 76 and 77. Read it and tell me what is the difference between them. Yes. Yes, the procedure is repeated on the same day, but if it is done by same physician, it is 76. If it is done by different physician, it is 77. After 76, you can write, for example, nebulization treatment. In medicine chapter, we saw that. Nebulization. For nebulization treatment, if it is repeated in the morning and evening, you can use modifier 76 if it is done by the same doctor. But if it is a different doctor, you can use modifier 77 for the second procedure. Next is 78 and 79. The 78 is used for unplanned return to the operating or procedure room by the same physician or other qualified healthcare professional following initial procedure for a related procedure during the postoperative period. Patient has undergone a surgery, but now he needs one more surgery. He is coming to the operating room, but it is unplanned return. The doctor did not plan at all, but there was some complication. Because of the complication, patient has come into the theatre. Again, he needs a surgery. The surgery is also related to the previous surgery, and it is done by the same doctor, which was not expected by the doctor. Then you will be using modifier 78. Modifier 78. This is unplanned return. The surgery was not a planned one. The second surgery I am telling. Second surgery is not planned one, but patient has got some complication, due to that he is undergoing second surgery, then you will be using modifier 78. What is 79? Tell me the difference between 8 and 9. Yes, 78 says it's a related procedure. 79 says it's an unrelated procedure. For example, I did some treatment for fracture for the patient. I did a surgery and did some fracture fixation. But during the post-operative period, patient had a heart attack. I have to do some CABG procedure, coronary artery bypass grafting I have to do. It is like not related to the previous surgery, but patient needs an immediate surgery. And it is happening during the post-operative period. And I am the same doctor who did the previous surgery. I am doing the second surgery, but which is not related to the first surgery. Then I will be using modifier 79. Modifier 79. So this is for unrelated procedure. Next is modifier 80. That is for assistant surgeon. Whenever a procedure is done by an assistant surgeon, you can use modifier 80. Near this you can write example is coronary artery bypass grafting procedure with cardiovascular system. We see this modifier 80. CABG procedure. CABG. Coronary artery bypass grafting procedure. With this we use this modifier 80 for assistant surgeon. We don't use this 81 and 82. So we can skip that. Take modifier 90. This is for reference or outside laboratory. This we saw with the pathology chapter under anatomic examination or postmortem examination. In pathology chapter, postmortem examination, we have seen this modifier 90. In this case, what they will do is, for example, they are doing some postmortem, but they don't have certain lab facility in the hospital, so they are sending the sample to an outside lab. Then they will use modifier 90 with the procedure code. So that will say that the procedure is not done in the same hospital, it was done from an outside lab. That is modifier 90. Next is modifier 91. Repeat clinical diagnostic lab test. So this will be used with pathology chapter codes. Whenever a lab test is repeated, but you should not repeat it because of the error that was done by the lab people, or you didn't you're doing it to confirm the first result. So there was some error on our side. For that you are repeating the test, means then you cannot report this modifier 91. But you are doing a repeat lab test. For example, in the morning I did some blood sugar test for the patient. It was very high. So in the evening I am repeating it. I just want to confirm whether it is the same blood sugar level or it is something wrong. So in such a case I am repeating it. I can use this modifier 91. So I am doing multiple tests on the same day. Then I can use modifier 91. So this will be used with pathology chapter codes. Next is 92. Alternative lab platform testing. This also will be used with pathology chapter. Under HIV testing, we have seen this modifier 92. Alternative lab platform testing. For example, we are doing some test, but it is not done with the proper lab technique. I am doing it with some alternate methods. For example, I can say that we do the pregnancy testing and all. With the Praga cards and all we are using now. And also during COVID time, you would have heard about the rapid card test. You don't have to go to the hospital. You can get the card from the pharmacy and you can do the test yourself. So that is all done with disposable kits, which doesn't require a lab. So those testings can be reported with modifier 92. And for example, you can see the HIV testing codes 86701 to 703, and with 87389 we can use this modifier 92 if an alternative lab platform testing is used. Next is 93 and 95. 93 is for synchronous telemedicine service rendered through telephone. That means we are giving a telemedicine consultation to the patient through phone call. Through a telephonic conversation, you can use modifier 93 with the ENM codes. '95. What is the difference between 93 and 95? Yes, it is a real-time interactive audio-video telecommunication system. That means it is a video call. The previous one is just a telephonic call, and the second one is audio and video call. So through a video call, they are discussing about the patient's condition. Next is 96, 97. We will not use it. 99. This also we don't use, but the thing is it is for multiple modifiers. For example, for the same procedure, I am going to use two modifiers. I can say that I am using modifier 22 and 50 with the same procedure. But before that, I can report this modifier 99 to say that I am going to use multiple modifiers. So modifier 99 will be added to the basic procedure, and after that you can report the applicable modifiers. It can be 22, 50, whatever it is, but before that you report modifier 99. That is for multiple modifiers. Next is you have anesthesia physical status modifiers. This we will discuss with anesthesia chapter. Then the next section is modifiers approved for ambulatory surgery center, ASC. So whenever they say ASC, it means daycare surgery center. Daycare surgery center. So in daycare surgery centers, they can use some modifiers. So you can go through that. It is all the same which we have discussed, but you have modifier 73 and 74 in addition here. Take 73 and 74, page number 972. Read them, find out the difference between them. This will, yes. So patient was planned to have a surgery, but on that day, prior to anesthesia, they are noting that there is some problem and they are cancelling the surgery. Then they can use modifier 73. Modifier 73, and as it is done in ambulatory surgical center, we are using modifier 73. And they are again in ambulatory surgical center only. The surgery was postponed or it was discontinued after giving anesthesia. Then you can use modifier 74. Modifier 74. So this will be used only with ambulatory surgical care. And I hope that you all would have understood about the common modifiers which we use in addition to CPT codes to describe the modification that is done with the surgical procedures. In the next video, I will discuss about medical terms which we use commonly in the CPT book. Thank you.